Great, welcome back. Nice sunny day in Sonoma County. Today is May 27. I'm back again today with Gary Green with some topical issues, and I'm going to give you some updates today about our group as well. So Gary, it was 90 plus degrees yesterday. People are going outdoors. What do we know about how the virus behaves outdoors and how it affects our exercise and sweating and all those things?
Yeah, that's a good question. So it's nice to be back again. And I would say that being outdoors is really your friend, especially in the warmer weather. The virus doesn't survive very well outdoors. The heat dries out the virus and kills it very quickly, and even a simple breeze outside will disperse the virus and make it less transmissible, so it dilutes it in the air. So I think being outdoors is remarkably safer than being indoors. Most of our data indoors with negative pressure rooms and HEPA filters, that's all based on indoor activity with tuberculosis. Outdoor is by far 10 times safer with this virus. So I think it's okay to be outdoors. The question is, you still don't want to be outdoors where you are touching high-touch surfaces, and you don't want to be outdoors where you're clustering and cohorting with people in really close proximity. So I think being outdoors, you definitely want to wear a mask. Being outdoors, you don't want to be in groups of people. And when some people do outdoor activities like they jog together, they walk together, or they bike together, it's very common for us after an activity to all get together and have a drink or be social. And it's in those clustering that people can still spread the virus. So the virus is contagious outdoors, but it's much less in the indoor because of the heat and the breezing. But social distancing is very important.
So Gary, I got to ask, when people sweat, is it possible to transmit the virus through our sweat?
That's a really good question. I've heard that a few times. Sweat is not a risk for the virus. So if someone bumps up against you and they're super sweaty, that's not a risk. It's a respiratory virus. It's respiratory secretions. The other thing is that what if someone is jogging past you and they're breathing really hard and they're not wearing a mask? The time you encounter that person for just a moment is so brief outdoors that that's not much of a risk either.
So Gary, a lot of time has passed. There's so much literature and data out there. What can you tell us as an update about pediatric population?
Yeah, so most of the cases we're seeing are in the 18 to 45, 18 to 50 age group. We worry about the elderly because when they get infected, they have a harder time of it. But we're now starting to see a little bit of pediatric cases. With 1.6 million confirmed cases in the US, we're bound to see some pediatric disease. And we're seeing unique things in the pediatric cohort, like certain abdominal features, Kawasaki-like disease. But the good news is the incidence of pediatrics is really low. It's a very, very small cohort of patients, and not that many are severely ill. It's being studied really well. I saw a recent presentation from George Washington University, and they really characterized it well. Kids seem to recover really well, but the incidence in children is very low. Now, recently there's been some very interesting data with pediatrics. So the receptor in the nasopharynx that attaches to the virus is called the ACE2 inhibitor. And that receptor in kids under 10 are very low amounts. So children under the age of 10 don't have very much of this receptor for the virus. That means two things. One, children under 10 are less likely to get infected, and if they do, probably have an easier time with the virus. So I think the pediatric data is being fleshed out in science, and we're learning much more about it, and it's not going to be much of a risk. There are some kids that might get sick, and we're seeing that across the nation, but it's very rare. We still worry about the elderly. The elderly patients are incredibly vulnerable, and there's still a problem with major mortality in the US.
So Gary, probably the most common thing we're reading about in the paper now is this effort to loosen up restrictions both at the state level, the county level. Are there any predictable repercussions that we can expect from those moves?
Yeah, so I get that question a lot about what is my thoughts or my opinion about kind of what the governor's doing or what the health officer's doing. Governor Newsom is opening up and loosening restrictions in certain areas based on criteria, but the whole motive for that is to keep the economy going. And so we don't want things to stall and end up in a deeper recession. So right now, loosening up restrictions is an economic decision, but we're loosening restrictions right in the peak epidemiologic period. So this is when our case numbers are the highest. So when our case numbers are the highest, we're trying to be as safe as possible to let some people go back to work, to let some businesses open, and to let some people do appropriate things. So I think that right now we need to tell our patients, if you're going to go outside, if you got to go to Costco, if you're going to go back to work, because we all have bills to pay, we need to do that in a really super safe manner, which means very much wear a mask whenever you're outside, whenever you're around people. Definitely do social distancing. Wash your hands a lot before and after a lot of activities, especially if you're in an area where there are high-touch surfaces like doorknobs and windows and tabletops. So I think it's very important right now that social distancing, masking, and washing your hands is really the best thing we have in the setting of the county loosening up its protocols.
So it seems like all this time, some things have not changed at all, and that is back to safety. Masking, social distancing, washing our hands. And I think that what our providers need to know is that is paramount to our group. Every morning, and we have done this every morning of the week for the last 2.5 months, our local group and foundation leadership meet. We digest the latest data, the latest suggestions, and that's what we use to create the safety measures at our clinics. And I think we feel good about that. And I think the fact that none of our providers or our staff have received exposure and become down with the virus with these safety measures in place. So we're now, 2.5 months into the shelter in place with the deferral of medical care to our patients. And we're starting to feel like there's going to become a little problematic as we continue down this path. We have 115,000 patients that we see in Sonoma County. And of that group, 55,000 of them count us as their home, which means they claim a PCP here and they receive most of their care here. And as we continue to defer care, you can imagine that it could be problematic later in the year where they all simultaneously seek care, and that could likely overwhelm our access. So I think that you should feel comfortable now as you contact people to really recommend that they start to address their medical needs now and invite them in. And of course, invite them in a way that's comfortable for them. They can come in for an in-person visit, or we can offer them a video visit. I think we're at a point now where all the departments have set up block schedules for video visits. So in your scheduling template, we have purposely put in video visits, and that is an effort to level the patient volume that's coming in person to our offices so that our lobbies and our waiting rooms can accommodate safe distancing. So, we've tried to communicate our safety measures to the county in a variety of ways. The county has 500,000 people, so no one way is going to work. But we've done radio interviews, we've done newspaper interviews, we've sent out MHOs and letters. And it's still hard to get to everybody, so I think we all need to play a role in informing our patients. So as you come in contact with patients and talk to them, feel free to continually inform them about the safety measures we've undertaken. You might consider using the smart phrase, .smugger-safe, which includes that. So, and for those of you who don't receive much feedback, I do want you to know that patients often give us feedback that with their sense of gratitude, they feel very good and very safe in the measures we've taken. So all I can say is keep up the good work. We're doing well. Thanks. And Gary, thanks for coming today.
Thank you very much.